Welcome to Sit Downs with City Lifestyle, Vegas Edition podcast. My name's Chrissy Bound, publisher for Henderson City Lifestyle, and we are back with our Meet the Partners series. Joining us today on the podcast is Dr. Tanita, founder of Henderson Women's Care. Welcome to the podcast.
Thank you.
We're so excited to have you.
Thank you.
You are such a busy guy, and we really appreciate you making the time to join us today.
Sure.
So for those who are not familiar, you've been practicing in the Valley for such a long time. Tell us a little bit about Henderson Women's Care.
Yeah, Henderson Women's Care. It's an OBGYN practice here in Henderson off of Stephanie in the 215. And the OBGYN, stands for the obstetric side of things, and the GYN is GYN.
Yeah.
Yeah.
So what was it that made you decide to go into women's care?
Yeah, I've been asked about that before. So,
Yeah.
so when I was younger, my mom, she grew up in Brazil and didn't really have much of an education. And so when she's like, when I have kids, they're going to have really good teeth and they're going to be educated. So
I love that.
So she used to drill in her head, okay, do what you love, but be a doctor. But do what you love, but be a doctor. So she kind of drilled that in her head.
As long as it's in medicine.
Right, you know. So anyways, so my brother's a doctor, actually. He's an ER doctor. So, you know, when I was going into undergrad, they were like, well, what do you want to major in? And I thought, you know, biology, sure. I'll go down that path.
Yeah.
So actually I went down that path, and I thought, you know, I had a family practice doctor that was my doctor. And so being a doctor, I just kind of visualized him. And so I went down that path. And actually, I did IT stuff before I went into medicine.
Interesting.
So this is kind of a longer story, but I'll try and shorten it up. So I went into IT, had my own business. I worked for the school district, had different clients. And I lived in Santa Barbara. It's pretty expensive there. And they say, you know, the newlywed and nearly dead because nobody can afford it.
Yeah.
So got married. And then I remember thinking like the tech bust came, you know, it was a big boom, and then it was a big bust, and got laid off, and then my business was kind of struggling, and I was like, I was wondering what I wanted to do. I was talking to my brother, and he was in medical school at the time, and he was like, I thought you wouldn't go to medicine, and I thought, you know, yeah, maybe I might want to do that.
Yeah.
So then I went into medicine, pursued that, got in medical school, did residency. So when you're in medicine and you're going to medical school, you do different rotations in different specialties, you know, family practice, internal medicine, ER, and obstetric and gynecology was one of those specialties. So you do rotations, and I had just done a medicine rotation, and you know, thinking I wanted to go into family practice or medicine because that's what I knew. I didn't really have any doctors, physicians in my family, a lot of dentists, but not physicians, and my brother was in medical school. So I had done a medicine rotation, and I remember, you know, it was there was a lot of people that were sick and dying, and it was kind of sad. And I'd come off that rotation, and then I was doing my OBGYN rotation, and I actually delivered my first baby in medical school, which, you know, sometimes it happens. Sometimes medical schools, you know, students don't get to do that.
Yeah.
And so that was really cool. I was working with a midwife, and she, you know, was like, okay, kind of taught me what to do and kind of showed me different things. And I thought, you know, everyone was happy and excited. And I was like, wow, that was really an amazing, you know, event that happened. You know, we're giving each other high fives, and everybody was really happy. So that's kind of what sparked my interest. I was like, wow, that was really amazing. So and then I had Dr. McDonald who kind of was helping me with that, and I'd do surgery with him, and he had no other students with him, and so he was an attending, and I got to do surgery with him, and
That's awesome.
He really took me under his wing, and I really enjoyed that. And so another thing that you can do when you have kind of like elective rotations you can do, and I thought, well, maybe I might want to do this. This was really exciting. It was really fun. And so I did what's called a sub-I, where you're a medical student, but they kind of treat you like a resident. It's more demanding. You go in early. And so I did that to kind of test the waters to see if that's something that I'd like. And I loved it, and it was great. And so I thought,
this is it.
It was the last thing I would have thought I'd go into. Yeah. And it was great.
How exciting to have bringing a life into the world, you know, like be the moment
amazing.
Where you're like, okay, this is what I'm going to do. This is totally going rogue here, but do you have a rough idea of how many babies you've delivered?
Oh, it's thousands.
Thousands.
Yeah. I mean,
what a great moment that you're with people during the biggest moment of their entire life.
It's amazing. It's great because, a lot of new moms are scared. They don't know what to expect. And it's great because I can just go, well, I know, you have probably 1,000 questions.
Yeah.
I can answer, the top ones, the main ones.
Yeah.
And then, I always tell them, you're going to have questions when you
Yes.
leave here. Put it on your phone because otherwise you'll be like, oh, what was that super important question? I can't remember what it is, but we always have our phone with us.
Yeah.
So then they, I can answer all those questions and really put their heart, at ease and their mind at ease because, it can be
stressful and
Sure,
scary.
Of course.
Well, speaking of which, are there any common concerns that you're seeing women, having throughout your practice here in the Valley right now? Like anything that's common that you're seeing as just coming up frequently with women that you're seeing in your practice?
Yeah, I mean, the biggest thing is just finding physicians.
Yeah.
That's probably the biggest thing. Doximity is a company that, looks at healthcare in the United States, and they did a study, and they said, Las Vegas is the #1 shortage of OBGYNs in the country.
Wow.
I think Salt Lake City was #2. But there's just a huge demand. So there's a growing population.
Yeah.
A lot of people are moving here to Vegas and Henderson from other parts of the country, and it's growing. And the OBGYNs, they can't get enough OBGYNs in town. So it's a huge issue, and it's a big issue in the country, but specifically Vegas and Henderson area. So that's really one of the biggest things is I just can't find a doctor. I mean, there was several doctors that just in our area at the hospitals that we delivered that had retired and stopped practicing obstetrics. And so there's a huge demand.
So if you're watching or listening to this and
That's
you're interested
right.
in OBGYN,
There's the
then,
plug.
Yeah, here's a plug.
Yeah.
Come on over here to Vegas.
There
It's
you go.
interesting and it makes sense because the city is growing so rapidly right
Yep.
now. And you guys are growing so rapidly
Yeah.
right now. And you just expanded your services from OBGYN into hormone replacement therapy and aesthetics. So what was kind of the draw for you in terms of wanting to expand your services at your practice?
Yeah, so we, traditionally when you come out of residency, you're doing obstetrics and gynecology. And when I started my practice, that's obviously what I went into. That's what I'm trained in, and it's great, and it's wonderful, and we were really growing in that. What is specifically with hormones, and so I'd done training in hormones in residency, and we've done plenty of that. What I found was that as we were growing, there was more and more of my patients were asking me about hormone replacement therapy and aesthetics, and we would do some hormone replacement therapy, so specifically with hormone replacement therapy. I was having a conversation with one of my colleagues that I did residency with. He's in Florida, has his practice there. And we were talking specifically about hormone replacement therapy. And he mentioned about pellet therapy, testosterone therapy. And we were talking about the different, he does pellets, and I wasn't doing pellets at the time. So we had a discussion about that. He said, there's plenty of research. I started doing some research, and he was telling me, it is amazing. It's life-changing. His patients loved it. And I wasn't really getting those results with my patients. I wasn't doing testosterone therapy. And as I dove into the research and looked into it, it was just pretty amazing on how much research there was on there. And so I started that. He kind of helped me with that and started it. And we just found that it was life-changing. And it was really amazing. And so really the demand was there. People... there weren't a lot of doctors that were talking to their patients about that, even though they were hearing it on podcasts and social media. And they're just like, who are these specialists that I can talk to about this? And they weren't getting a lot of that from a lot of the doctors in town. And so that's really was driven by patients talking to me about it. And then when I got started, just the results that we saw was amazing. So
I think it's awesome because, when I was growing up, it wasn't as common. And I remember, and I know my mom won't care if I share this, but I remember my mom was going through some of those changes in life. It was a crazy time because she's starting to go through menopause right as I'm hitting puberty. So it's an ongoing joke. At our wedding, my brother, poor guy, has like the patience of a saint. He actually made it into his wedding speech. He's like, you know, everybody that's at this wedding knows my sister, and most of the people in this room know my mom. And I just want you to think about the fact that I lived in the same house with both of them at the same time, and it was just a clash of the titans. It was a clash of the titans. But I mean, I think that back then, you know, the typical response was to just kind of gut your way through some of those hormonal changes, whereas now there's so many better options to improve your quality of life, you know?
And absolutely.
You know, it's so much easier to like, there's no need to gut your way through anything anymore, you know?
Sure. Well, I mean, they did this huge study called the Women's Health Initiative study that came out, and a lot of people have heard about it. And what happened was so we've known about hormones since the 30s. There's tons of research on it, and we've looked into that. And basically, women were having these symptoms, and so they said, hey, we know that it's related to estrogen and different hormones, and so they were giving women these hormones, and they were doing great. And it was like, wow, it's wonderful. So naturally, I mean, they were looking at the safety of this and said, hey, let's look at its effect on cardiovascular disease and breast cancer and stroke and different things like that, because we did know, you know, certainly certain properties about, you know, different hormones and its effect on the body. And so when the study came out, it was a huge study. They found that there was a slight risk of breast cancer and slight risk of stroke. And with anything, you know, life is just really a series of trade-offs. And so I think what happened was there was kind of a knee-jerk reaction where they said, hey, there is an increased risk of stroke, and it's about 1 in 1,000 for every year that you're on it. And so so there was a slight risk of stroke and cancer. And so what happened was a lot of doctors saw that, and they kind of had a knee-jerk reaction and just said, okay, nobody be on hormones. It can, you know, there's risks involved. But, it, you know, in one aspect, it's kind of silly because it's kind of like if they're like, hey, there's this thing, it's called a car, but people die every day on it. Nobody use a car. It can there's risks involved, just nobody use a car. And so I think that was kind of an overreaction, and they've done lots of studies since that, and they're seeing that in a lot of ways, you know, I think the average age was between 65 and 67, and so the number one risk factor for breast cancer is age. So as you get older, the risk goes up, and so if that's the average age on the study, you know, theoretically, most people that are starting hormone replacement therapy in their 40s and their 50s, the risk is a lot lower. So really, you know, our jobs as physicians are really to discuss the benefits, the risks, present that to patients, and let them decide. You know, if they have serious risk factors of history of breast cancer or really bad heart disease or stroke, you might want to recommend something else or some other things that you can do. So,
well, and what are some common symptoms that people might just mistake as common aging that are things that you can help with?
So, you know, I mentioned, you know, there's good and there's bad. You know, so as we age, we know like wrinkles and gray hair are coming. So
it's already here for me.
It's going to hit. That's the bad news. The good news is there's things you can do about it. So as far as what you can do, it's really an issue. Aging is going to happen, obviously. It's upon us. It's coming for us. It's happening every day. So the question is, what are our options and what can we do about that? So it's not so much like what's normal. A lot of women are like, you know, I want to get my hormones checked. I want to see where I'm at. You know, if a 7-year-old comes in, it's like, I know what your levels are. They're low. They're zero, you know. And it's not, and that's normal. You know, that's normal. The question is there something, it's like, well, some of the issues are, you know, I have decreased energy, low libido, brain fog. I just can't remember. You know, just can't get up and going. More anxiety, more depression, gaining weight. It's like, really the question is, what can I do about that? So, you know, a lot of women will say, do I need to be on hormone replacement therapy? And the answer is no. Nobody needs to be on hormone replacement therapy. Just like nobody needs to be on Tylenol and nobody needs to be on ibuprofen. You don't need to be on it. But, you know, if I take a bottle of Tylenol and I take it all, I'll go into liver failure and die. So that's bad. But if you take a little bit, if I have a headache here and there, it's very helpful. Quality of life. That's pretty much what hormone replacement therapy is. There's a lot of benefits.
A lot of benefits. Well, obviously. And you mentioned the wrinkles and the gray hair. And, you know, truthfully, aesthetics, it's part of our lifestyle in Henderson, you know, and in the Valley. Like we're unique in the sense of we have a lot of formal events to go to. We have galas, we have stuff. We want to look our best.
Of course.
So, you know, with that, what are some of the most popular aesthetic treatments that people are requesting now?
So in the aesthetics world, if you just look at pure dollar amounts and what are people asking for, by far Botox and fillers are the most common and the most popular. And the reason for that is pretty straightforward. It's very effective. It works very well. Straightforward. People understand it, and you can see the effects usually immediately. A filler, you can see it immediately. With Botox, it takes a couple of weeks, but it's very effective in it, and it looks great. People, there's plenty of opportunity around access to that. It's relatively cheap compared to like plastic surgery and a lot of these lasers. So that's really the most popular, and most people know about that. You have other issues, other things that are available, including skin tightening. You have surgery that are other options. That gets a little bit, it's more invasive. You get more of an outcome, more dramatic outcome. But yeah, those are definitely
the top ones.
Yep.
And what do you think? I mean, a lot of different places are offering these types of services now. Not all of them are physicians. Like, what would your advice be to somebody for the reason for why they'd want to go see a physician versus just going to some of these places that are just injectors?
Sure. So, it's relatively safe. I mean, everything has trade-offs, and obviously surgery, there's more risk, but you get, there's more of a dramatic effect. And obviously, you wouldn't want to have surgery on your face on somebody who's just walking off the, off the street. And so, where there's more risk involved, you want somebody with more expertise, more experience in that. Botox and fillers again are relatively safe. Specifically with Botox, fillers, there's certainly some risks that are involved, and so. Wherever there's more risk, you want more skill involved. So, having a physician or a physician-led or even, nurse practitioners, physician assistants that are doing that, of course, you want a more skilled, more knowledgeable person to do that. So with fillers, there are some risks. You want to know the vasculature. You want to know where you should be injecting, where you not want to be injecting. Nothing's 100% safe in the sense of there's absolutely no side effects with anything, but you mitigate that by having someone who's more skilled and doing more of that.
And knows the system.
Sure, of course.
Absolutely. Well, it seems like you're moving towards more of an overall holistic health approach with all these different facets of what you're doing. And you just moved into a brand new office. So congratulations.
Thank you.
So share where your new location is.
1348 Paseo Verde, Parkway Suite 100. So that's off of Stephanie and the 215.
That's a great
We're doing
location.
all kinds of construction there. So it's great. It's really easy to get on and off the freeway. So.
Well, and as we kind of wrap up here, if there was one piece of advice that you would want all of your patients and women in the Valley to follow, what would it be?
I think it's if they can establish care with an OBGYN, that would be the first step. I mean, obviously you have to get that appointment. It's hard to find OBGYNs. So with that, when you establish care, you build a rapport with that OBGYN, and they can definitely talk to you about different screening tests from obviously eating healthy, breast cancer screening, cervical cancer screening, STDs. I think that's one of the best things you can do. And then from there, you can talk about what they want. So there's obviously aesthetics. When should I see a physician? I'm interested in this. So there's much more, traditional medicine, we learn about the body. We learn about disease. So we definitely want to be screening for certain things, and there's a purely medical side of things. But obviously medicine is a lot more than just treating disease. People are like, okay, well, I'm doing everything right. I'm eating clean. I'm exercising. Don't smoke, drink, do drugs. What else can I do? How can I, again, this is where anti-aging and different things come in. How can I, not just treat disease, but how can I live a healthier life, more productive life? Hey, I have these different symptoms. That's where you can talk to the physician and get a little bit more care as far as what can I do for preventative medicine. Hormones. Obviously, when women are going through menopause, they're having some symptoms. What are my options? And, I often kind of joke around and saying, I'm kind of like a waiter. I say, here's the menu. I can make certain recommendations. But you're the one that has to eat it. So it's like, I love this part. I love that. That has some risk, and they can decide. And really, it's not for me to tell women what they want. It's just like, here are your options. This is what the recommendation, says. Here are what the studies say. Here are the pros and cons, and then you kind of decide. And so they have to decide for themselves what they want, whether it just be the healthcare, treating disease, aesthetics, different, just working with the body and what their goals are and helping, we're a team to kind of help them meet their goals.
I love that. I love that you said it's not for me to tell them, it's for me to provide them with solutions. A smart man.
Go.
Well, you have a family of your own too here in Henderson.
Yeah.
So, you've obviously learned that that's what women want. We want to be able to be provided with our options, and then we'll decide from there.
Sure.
So, okay, I have to know, when you're not working, what do you like to do here in Henderson? I mean, most people see their doctor, like if they see their doctor in the grocery store, it's like, they live outside of the office? What is this,
Yeah.
So what are some things that you love to do here in Henderson?
Well, I have 3 kids and we have 2 dogs, and so we love spending time with our family. We're foodies, so we'll go out to eat out, spend time with the kids, when we bring food. So I have a 20-year-old, a 19-year-old, and a 15-year-old.
So you're in the teen and post-teen years.
All good stuff, yeah. So, it's great. They all live here in town. 2 of them live with me. One's on his own. And so, so we spend time with them. My wife's very active in doing different clubs. She's a huge CrossFitter, and she's climbing mountains everywhere.
Good for her.
She's very active. So I'll go on a couple adventures with her. So I try to stay active. We walk our dogs. We love hanging out with our dogs. I do jujitsu. I did it with my older son, and so we were doing jiu-jitsu. I was, a Carlson Gracie jiu-jitsu.
Yeah,
and so
very nice.
I did a tournament. I broke my ankle.
Oh, no.
So I was out for several months, and then I was going back, and then I got tennis elbow. I'm getting older, so that slowed me down. But, yeah, we try to stay active. We're kind of doing a little bit of pickleball now, and that's kind of fun.
I love pickleball. It's great.
Yeah.
Have you been to the chicken and pickle place over?
Yeah.
So much fun over there.
Yeah, we did a little family time out there. That was fun.
Yeah. Well, I love to see, you do a lot within the community, and obviously for many, many women here in Southern Nevada. So we appreciate all that you do. And if people are interested in reaching out to schedule an appointment with you, how should they reach you?
So they can go to our website and ask. That we have a forms that they can do there. They can always call.
Yep.
So our website is www.hwcobgyn.com. So for Henderson Women's Care, or they can go to hendersonwomenscare.com, or they can call our phone number 702-847-6252.
Awesome. Well, thank you so much. I know you got a lot going on, and you're always on call, and I just appreciate you making time to join us today.
Thank you.
Thank you, everybody, for listening or watching. Remember to subscribe to the channel, and we'll see you guys next time.